Hi guys, and welcome back to my channel. So today we're going to be doing a video about lupus and the sun. So people with lupus are often sensitive to sunlight, primarily UV rays, and I figured what better time to make a video about this than when summer is officially here in the UK, and whilst I am in sunny Jamaica. I'll give you a quick view of what I can see in a minute. As always, if you do like this content, if you enjoy this video, find it educational, please feel free to share it with a friend, a family member, and also like and subscribe. Leave me a comment if you like. But yeah, let's get right into it. Okay, so let's get started. I briefly covered this in my What is Lupus video, but as you may or may not be aware, many people with lupus have a sensitivity to light, primarily sunlight, and this can cause a flare in lupus-related symptoms. So I'm just going to go a bit more in depth, discuss a bit more, but the most common reaction is a photosensitive rash, similar to a heat rash caused by exposure to UV light. So first of all, what is light sensitivity? So light sensitivity is when pain or discomfort is caused by exposure to sunlight. This sensitivity can occur when exposed to fluorescent light and incandescent light as well, which is the lights that you have inside your house. For some, bright lights in general are an issue. For some, all light in general is an issue. When it comes to lupus, the most common issue is ultraviolet light or UV light, which is what the sun fires at us primarily, amongst other types of light, but this isn't a chemistry video. So UV light from the sun can cause issues, but also from lamps can cause issues. So often people with lupus will feel unwell after we've been in the sun for a while, maybe tired, fatigued, that kind of thing. So yeah, that's how photosensitivity can affect us. In the most extreme cases, even a few minutes of sunlight can cause really bad reactions. For me, I can be in the sun for a couple of hours, but I do start to get really tired really fast, a lot quicker than the average person. So yeah, generally sunlight, no go for lupus patients. We try and avoid it. So the symptoms that you can see, let's talk about those. The main noticeable visual symptom will be a rash. You will get a rash, you will see the rash, and it will itch, and that's a problem. If I can find some pictures of a rash, I can include them on either side of my head, but if I can't, then let's just skip that. Other symptoms are quite common, so you can get migraines, nausea, joint pains, and fatigue. Fatigue is it's quite common in lupus in general anyway, but often fatigue will, aside from obviously a visual rash, be the first non-visual symptoms that you might notice. Joint pain, inconvenient, joints might swell. For example, when I come to Jamaica every time, for the first week or so, my ankles are really swollen, just from the change in temperature and being on the plane. So joints can swell up, and that's obviously quite painful. Other symptoms which can be worsened by the sun are, you could have fever, which is obviously when you're very hot. Pleurisy can be worsened in sunlight. Now, I didn't know that until I did the research for this video. So I have pleurisy. Pleurisy is when the lining around your heart and lungs in the cardiovascular system gets inflamed, and it hurts when you breathe in and out. Not all the time, obviously, but for some people it might hurt all the time. For me, it doesn't hurt all the time. But that inflammation, an increase in inflammation, can worsen pleurisy as well. So kidney disease, nervous system problems such as epilepsy, these can all be worsened by exposure to sunlight. And in the most serious cases, lupus patients may experience these when exposed to artificial light, such as like lamps within your house, lights within your house, and not just from UV light. So obviously that can be extremely inconvenient. So shall we talk about why this happens then? So why does this happen? What happens that causes us to hide from the sun like vampires? Well, in short, UV light, which is made up of UVA, UVB, UVC primarily. UVC is neither here nor there in this case, but UVA and UVB rays damage skin cells basically. And that's what causes you to get burnt when you go in the sun. This UV A and B, which is what sunscreen protects you from, which is why you should wear it, damages those cells in your skin, and it burns essentially. The cells will die and you get sunburn. This can also cause skin aging, skin cancer, which we're all aware of. When these cells die in a healthy body, the response of your immune system is to get rid of them, sweep them all out. So in the normal body's response, the way your body will deal with these dead cells is it will clear them out. Your immune system will respond, find all these dead cells, let's get rid of those, we don't want them building up. That's how the normal body works. You know, for me and other lupus patients, obviously we're aware our immune system doesn't work like yours. So the sunburn for a healthy body will go away quite quickly, often, unless it's really bad sunburn. And if you're getting really bad sunburn, please, honestly guys, just wear sun cream. It's not that deep, please wear sun cream. But it might go away in a regular person after a couple of days, you're feeling better. That immune response to get rid of those cells will not happen in someone with lupus. Not to the same extreme. Like it won't happen quickly. So these dead cells will start to build up, which is obviously not a good thing. As well as that, not just from them building up, the cells themselves are more sensitive to being damaged by UV light, which is, again, not a good thing. So once these cells build up, the contents of these dead cells is sort of released into the body, which will interact with your immune system and stimulate an immune response. Nuclear proteins, or nuclear antigens, which is what's inside these dead cells, they release from this build-up. They're all building up, they start to release into your body. Your immune system is then kicked into action thinking, what's this in our body? We need to get this, we need to get rid of it. And your immune system is then really, really active. And as we all know from the last video, an active immune system equals inflammation. Hence why you're gonna get swelling, you're gonna get rashes, and you're gonna all in all feel pretty groggy as a lupus patient in the sun. So, does this happen to all lupus patients? The short answer, no. About 60% of lupus patients get sun-induced rashes, and a further 10 to 20% experience clearly sun-induced symptoms. Now, obviously, that's not all, but 60 plus 20%, that's 80%. That's most patients will have some kind of sun-induced reaction. These new immune responses can take over a week to develop. So you might feel fine after spending a whole day in the sun, and then a week later you feel a bit like you've been hit with a bus. Yeah, think about that time you were spending in the sun, because it might just be that. In general, all lupus patients are advised to avoid being in direct sunlight, as this will make your lupus worse. And it's also advisable to take precautions with computer sets, lights in your house, phones, TVs. I'm not going to cover that section in this video just because this is specifically about sunlight. However, what I will do is I will link in the description the page on the Lupus UK website, which is where I gained this information from, and it does talk about how to look after yourself when it comes to lights in your home. You know, generally getting lights, fittings and fixtures that bounce off the wall and then light up the room rather than it shining directly onto you. You can get screens for you know, computer screens. You can get screens for your phone and that kind of stuff to filter out that blue light, as blue on the visible light spectrum is the closest to ultraviolet, which is why when you go to the nail salon, if you've ever gone to the nail salon, got shellac put on your nails, the light looks blue, and that's because it's UV light, and you know that is a very close wave number to blue visible light as well. So I'll link that. As always, I'll link the pages on Lupus UK versus arthritis as in the last video, so you can do some more reading if you want, but there'll be a bit more focus specifically on the sun, and I'll always link the donation page for Lupus UK if you do want to donate. Now we've got that bit out of the way, let's talk about how you can protect yourself. Now a lot of these are going to seem like common sense, but we're going to go through it anyway, and let's just get it out there. So, number one, don't go in the sun. That is, you know, the main way you can prevent any issues. Don't go in the sun. Obviously that's not practical. People go to work, people go on holiday, sometimes it's sunny. Even if you live in England, it might be sunny. I heard you had a blistering heat wave whilst I was gone, so, you know, in practice it's very hard to keep out of the sun completely. But, you know, don't sunbathe, don't sit in the sun for an extended period of time. If you're going to be outside, maybe try and sit in some shade, maybe try and find an area that is shady for you and still sunny for your friends, so you know they can sit in the sun if they like. Use sun cream regularly. Now let's discuss this one a little bit. On the Lupus UK page there is some information on how to find a good sun cream, but honestly it would take so long for me to go through all of that in this video, and I don't want this video to be too long, so I will link it below where you can find out which sun creams you should be looking at. But basically, high factor sun cream, high star rating sun cream, put it on regularly every 1 to 2 hours, especially in summer months, which is April to October in the UK. April to October in the UK. But yes, even though it's not hot, it's still summer. And even wear it in winter, even though it is not sunny, it might be raining, you can still get burned from cloudy days, you can still get burned when you can't see the sun. So basically, find a way to integrate it into your skincare routine that you put sun cream on every day. Now, let's do a little aside where I'm gonna talk to my melanated folks. Wear sun cream. Just because you have dark skin does not mean you will not burn. You will burn, and you're still susceptible to sun cancer, skin aging. You know, black don't crack, but it does if you leave it withered in the sun. So even if your skin is dark, please wear sun cream. And even if you don't have lupus, you should be wearing sun cream anyway if it's sunny. Generally, like, we all want to protect against skin cancer, so please just do your due diligence and put your sun cream on. Now, melanated folks, I know sun creams are a bit of an issue for us. You rub it in, it makes your skin go this kind of purpley colour. I mean, you can't see it right now, but I do have sun cream on, even though I am in the shade. I'm sitting in the shade because what was tip number 1? Keep yourself out of the sun. The sun is right there, I'm in the shade. But melanated guys and gals, sun cream can be a bit of a pain. I can't tell you I've found one that doesn't give me that purplish casket ready look. I haven't, but I will keep looking for a body one. Face wise though, the Olay, I've got the new Olay Whip with the SPF 30. It blends right in, you can't see it at all, but I know my face is protected. And Olay do quite a good range where the SPF isn't as visible, so when I get back to the UK I'll probably see if they have any body-based stuff, because at the moment when I put my sun cream on in the morning and reapply during the day, which I'm not that good at, but you should reapply during the day, it does leave me with this purplish tinge. So no matter what colour your skin tone is, lupus or no lupus, wear sun cream. But if you have lupus, definitely wear sun cream. It will make a difference. Please wear the sun cream, it will make a difference, especially when it comes to the rashes. Whew. Anyway, moving on. Tip number 3, avoid travelling to hot sunny countries or mountainous areas where there's more UV light than in the UK. Now, as you can see, I've already told you, you can't actually see, but I'm in Jamaica right now. Jamaica is basically a hot sunny mountain. So obviously it isn't always practical to not travel to hot sunny countries, and to be honest, I like sun too. I like to be in a warm climate. I just like to be in the shade because I can't stay in the sun like that. So yeah, use caution, exercise caution there, but you know, maybe try and pick a different time of year. Don't go to Dubai when it's 45 degrees in their summer and there's no shade and no breeze. It's gonna be a bit hot. Maybe try and pick good times where it's not too hot. That's all I can really say on that one. Tip number 4, beware of increased UV exposure with snow, sea or other water due to additional light being reflected on your body. Now snow, that's something we do get in the UK, and we do also have beaches. It's a bit cold, but if you're in the pool, if you're in the sea, if you are in the snow, light is going to reflect onto your body and add additional UV damage. So just beware of it. I'm not saying don't go in the water, just be a bit aware of that. Tip number 5, even in the UK, it is wise to avoid going out in the middle of the day in summer. So here is, I'm just going to check the time, it's 5 o'clock, which is why I've waited all day to come and film this, because it's 5 PM now and it was very, very hot earlier. So 12 and 2, maybe even 11 and 2, stay in a yard. Like, do not come outside if you don't need to. Do not be out in the sun if you don't need to. Now, I went on a tour of a plantation a couple of days ago and the started at 10:30, and when we went to the river bit and we got to go in the river, and it was really, really nice, but it was the middle of the day. It was 12 o'clock. The sun was at its peak heat and it was hot. It was 34 degrees, I was in the water, and when I say that took it out of me, it really took it out of me. Like, I was in pain, my joints were swelling up, I had to have painkillers, I could barely even walk when I got out. So if possible, avoid that time of the day if you can, of course. Number 6, put sun cream on and reapply it regularly. I've already talked about sun cream, but make sure you're reapplying it. When people go in the sea, they often forget that, or in the water, or even just when you're sweating and it's hot, people often forget that you need to reapply. When you sweat, and I don't know if you can see, I am sweating right now, and when I go back inside, I am going to go and put more sun cream on, because it will have sweated off of my body over time and it will transfer onto things. So make sure you're reapplying that sun cream, and don't forget the hard to reach areas like your back, the back of your neck, just because it's covered by hair or whatever, it can still get damaged. Your hands and your feet, and like the back of your knees, I find is also a pretty well forgotten area. So try not to forget those areas. easier said than done. I've got a bit of sunburn on the back of my neck because I find it hard to reach up there, but yeah, if possible, if you need to, get someone to help you, but try and cover as much of your body as you can with the sun cream. And put more on. People often only put one really thin layer on. You probably need a bit more than that. We all often don't use the right amount of sun cream, so put a bit more on if you're not sure. Use the sun cream on cloudy days. I already told you can still get burnt on cloudy days. That's tip number 7. Just wear it all year round. I put it into my regular lotion that I put on my body, so that every day I'm getting sun cream on my body and I'm protected. So that's a helpful top tip from myself. Mix it in with your lotion or something else that you have to put on your body every day. Tip number 8, if you're in the sun, cover your skin. So hats. Now obviously I don't have a hat on. A hat won't fit on with how my hair is styled at the moment, believe me. I tried, I couldn't get a hat to fit. But wear a hat, wear shades, which is why even though I'm in the shade, wear shades because I can still see the light over there. Obviously it's not really feasible to say wear trousers or whatever, but try and keep your skin covered if possible, especially hats. Try and cover up your shoulders. Obviously I know my shoulders are out, but I'm inside. Try and cover up your shoulders when you're outside, cover your head and cover your eyes, and anywhere else that's exposed, make sure it's really, really heavily sun creamed up. So those are my top tips. So let's move on to the last, potentially more drastic measure, I would say, which is medications. Now, medication may be used to combat signs and symptoms of, the overactive immune system. As we know, steroids can be used, but generally the best advice is to be on the lowest dose of steroids possible, and I would wholeheartedly agree with that. I've been on steroids for most of my life. I'd wholeheartedly agree with that. So obviously if you don't need to use the steroids, don't, but they can work at helping to dampen down the immune system issues. You can also use more drastic medications, your methotrexate, azathioprine, cyclophosphamide. Obviously that's for when your lupus is quite active. If you don't need to take those, I wouldn't recommend it because it's not very nice, because they are chemotherapy drugs and it's not very nice to have to go through. But something that has been working quite well, and I found does work quite well for me, is hydroxychloroquine. I know we talked about that a little bit in the last video, but it is very, very good at dealing with these sun-based issues. It can help dampen down the arthritis issues, it can help with rashes, it can help with pleurisy, and all of these things can be worsened by the sun, or they can be sun-induced altogether. So, hydroxychloroquine may be one to keep an eye on, as long as you get your eyes tested quite frequently. I can't report any horrible adverse effects from it, unlike with methotrexate and the azathioprine. Now, the last little bit we're going to talk about is vitamin D and calcium deficiency. Now, you may think, if I'm not going in the sun, where am I going to get my vitamin D intake? Well, the short answer is you might just have to take a vitamin D supplement. You don't necessarily have to go to the shop and buy it. Your doctor will probably be able to prescribe you one if they find your vitamin D and calcium is a bit low. They will prescribe that for you. They will give that for you. If you pay for your prescriptions, it's probably cheaper to go to Boots and buy it. But yeah, sometimes you will just have to take a supplement. Vitamin D, especially my vitamin D count has been low for a number of years because I really avoid being in the sun unless absolutely necessary. So I take a vitamin D tablet every single day. has my daily dose of vitamin D in it. When it's done, I don't have to worry about it. I do try and get vitamin D in other ways if possible, and that's great, but if I don't, it's done, it's taken care of. When it comes to calcium, I didn't really know that this could be affecting my calcium levels as well, but you know, I can have a chat with my doctor about that when I get back. But to know if these are low, you can chat with your doctor. If you're feeling tired all the time, if you're not feeling great, it could be your vitamin D. Believe it or not, most people who live in the UK are slightly deficient in vitamin D. This is because we only get about 5 months of good sunlight a year, and the rest of the time it's cloudy, it's overcast, it's raining. You're not getting a lot of exposure to vitamin D. Whereas over here, it's sunny, it's hot. I've probably had enough vitamin D for like 3 years that I would normally get in the UK just from being here for 3 weeks. So vitamin D deficiency is quite common, but I wouldn't say to worry about it. You're better off staying out of the sun and taking a vitamin D tablet. But if you are worried about it, I would definitely recommend you chat with your doctor. They can do blood tests to test your vitamin D level, calcium level, and see if you are deficient in either of those. Vitamin D you can also get from stuff like oily fish, eggs, nuts. Sadly for me, I don't really like oily fish and I don't really like nuts. I eat a lot of eggs, but that's not enough to supplement enough vitamin D for the day, hence why I take a tablet. If you eat a lot of fish, or if you live in a part of the world where there is a lot of fish, you may have a higher vitamin D count. Obviously, these tips are applicable wherever you live, but I can only talk about my experience being based in the UK and working with the NHS. So, if you've stuck with me, I appreciate you. Thank you very much for watching, and if you do find it educational, feel free to share with someone. I would say the main thing to remember is that your lupus friend, or this applies for most autoimmune diseases that I'm aware of anyway, we aren't trying to be difficult, but the sun causes us a lot of problems. So if I can avoid it, I will. Basically, yeah, if I can avoid it, I will. I'm not trying to be awkward when I don't want to come and sunbathe with you. I'm not trying to be awkward when I don't want to sit on the grass. I'm not trying to be awkward when I tell you that I'm tired after we've been sitting on the grass. I genuinely am tired because the sun wipes me out. That's just the way it is. But yeah, thank you very much for watching. As always, if you enjoyed this content and you want to see more in the Living with Lupus series, feel free to subscribe. I do also occasionally post other things like updates on my hair and, you know, vlogs I'm going to try and do. But yeah, as always, subscribe, like, comment. You can hit me up on my socials if you like. I post lots of lupus related memes and cute pictures of myself. So thank you very much for watching, and I will see you guys next time. Hi, Grandma.
I thought you were recording.
I am, but it's fine, I'll just cut it out. Tired. Okay, you're nearly finished.